Hello everyone, this is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to be today with Ann Estes, who I know virtually for many, many years, and her hard work to help patients getting access to advanced therapy in cardiovascular disease. Bailey, always nice to see you.
It's nice to meet you finally.
Thank you. So you gave a nice presentation about access to TAVR in rural areas, and this is kind of very important topic for graduate fellows and people building programs, especially in when you don't have access to large programs. So I would like to get your insight and what is your success story?
Yeah, so as we know, we've changed the Medicare rules for expansion of TAVR programs because it's much surpassed surgical intervention. We have a large subset of patients that need this therapy but don't have access to care. So where I live at is more of a rural area. It's about 100,000 people with a 300,000 encapsulation area that before 2019 did not have a TAVR program. So we were very excited with the change of the Medicare rules to be able to provide this therapy for our patients. But with starting new programs can be daunting, challenging, especially with taking care of high-risk patients. So we talked a little bit about dealing with high-risk patients. Should you keep them at home? Should you send them off? And we did a case presentation about a patient that we actually had in our TAVR program where we had only implanted 3 so far. And we had a very, very high-risk patient that we initially were like, let's send them off somewhere else, very high risk, but just wasn't an option for the patient. So we have stories all the time where they don't have financial resources, they don't have family to come take care of them. And a lot of times it takes multiple trips. So they can't just go there once, get everything done, which would be awesome, but we've had patients that try to make it and they end up sleeping in their cars in the hospital parking lot.
Right.
So we think, how can we keep them more at home? How can we do the best we can? So had this great high-risk patient that didn't have any other options, and really worked with the patient, worked with our team, and said, hey, this is what we're here for. We're going to give them that option. Everyone got on board. Really great teamwork throughout the anesthesia, throughout CV surgery, IC, and all of our ancillary nursing staff. Everyone got on board and had a great outcome, ended up for the patient. So since then in my area, I feel in West Texas, we've really done a great job of really wanting to advance therapies. So from back in 2019, we didn't have any TAVR programs in our area. Now we have several. So even in our catchment area, most patients have a TAVR program that they can access within at least an hour, which is much different than 2 hours, 3 hours. So, but a lot of the research isn't really reflecting that. We're seeing the biggest growth of TAVR programs within our metropolitan areas. So I really like to advocate for more programs, really expanding the care like it was intended to be.
Yeah. And so what resources you asked your administration that you needed, and how easy was it to get these getting lined up? Because I think this is the most challenging step.
Definitely. It takes a team approach and it takes champions of really explaining why is this a necessary procedure. Really showing how many people are suffering from this, how many patients can we help, and really bringing home to, with TAVR, there's so many different working parts involved. So we'll have that patient for their cardiovascular care, we'll have them for imaging, we're going to keep them for multiple studies, which makes sense to the hospital. So really presenting it that way, but also bringing it home to, if your mom and dad, you would want them to be able to stay
here.
home, right?
Exactly.
If you need to send them off, then you've got to take off work, you've got to do X, Y, and Z. So we've been very fortunate that they're very forward-thinking too, and thinking, I want to bring this prestigious program to our area.
Yeah. And I'm assuming you have a metric, so you have follow-up metrics on the patient and outcome, and you go back and present to them these success stories that kind of strengthen your case.
Definitely. I mean, we follow everything. There's TVT registry, which helps keep everyone accountable, but always looking at your quality improvements, great.
Yeah.
But we also like to pull out these certain, every now and then you get those patient stories that really hit it home, that you really have a chance to make an impact on these people.
Absolutely. Well, Bailey, thank you so much for your time and for sharing your phenomenal story. Please watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Bailey, thank you so much.
Thank you so much.